Doctors across the Bay Area are fielding a lot of calls and concerns about coronavirus. And joining me now is Dr. Laura Gross with Stanford Healthcare to kind of get us the right information, which is so crucial right now. Why don't we start from the beginning, though? What exactly is coronavirus? How does it spread?
Okay, so coronavirus is not a new virus. Coronaviruses have been around for a long time. They were first discovered by scientists in the 1960s, but they've been around before that. And as a group, when they infect humans, they usually cause respiratory illness. So respiratory illness like symptoms of coughing, runny nose, pneumonia, fevers. There's 7 coronaviruses that are known to infect humans. Used to be 6, now there's 7. The novel coronavirus is called novel coronavirus because this is the first time we've ever seen it.
Talk about some of the signs and symptoms.
Okay.
What are they so we can distinguish between that and, say, the flu?
Right. Okay, good question. So we're still learning about the coronavirus, but it is a respiratory virus that is similar to the flu, actually, in that it causes coughing, runny nose, sometimes shortness of breath, fever, very similar to the flu. It's actually interesting that the winter colds that go around are, like every winter, coronavirus is 35% of those viruses. So not the novel coronavirus, but the other coronaviruses that infect humans. They cause the common cold. So this coronavirus is very similar to that, but it looks like people may be ranging from the common cold symptoms to more pneumonia, more serious illness.
So there have been 200 reported deaths in China so far. Is the virus really that dangerous?
So there's a way to describe how dangerous a virus is. Number one is by how easy it is to spread. And it looks like this virus isn't as easy to spread maybe as some other viruses like the measles. You can describe how easy it is to spread. There's a number called the R0, which tells you for each person that's infected how many other people may get the virus. It looks like for this virus, for each infected person, they may spread it to 2 to 3 people, whereas the measles virus will spread it to like 12 people. So that's one way to describe how serious it is. And the other is the mortality rate. So this virus so far appears to have a mortality rate of about 2%, which is high when it's you or your family member. But if you compare it to some other diseases like the other coronaviruses that we've had, it's not as likely to cause death. So like the SARS virus or the MERS virus were like 10% mortality. So
we see a lot of people starting to wear masks.
Yes.
So are they effective, and what else should we be doing?
Good question. So the Public Health Department and the CDC are really guiding us in what to do. And at this point, they're not recommending that people wear masks to protect themselves. If you're sick and you want to prevent your family members from catching it from you or other people in the community from catching your illness, then you can wear a mask. So I get a lot of, last week I had a lot of family members that were sick with colds, especially mothers and fathers with babies who can't isolate themselves. And if they're sick and they want to prevent giving their illness to their baby, then yes, you can wear a mask. But otherwise, wearing a mask to prevent yourself from getting sick isn't helpful.
So what is helpful? What would be your top recommendation? I think I know what you're going to say. Wash the hands.
Wash the hands. So the number one thing, so the way the virus spreads is when an infected person coughs up respiratory secretions, it will go into another person's eyes or mouth, and that's how it gets into your body. So there's also a thought that if the person coughs and it goes like onto a surface, and you come by and touch that surface, if you touch your hands or your face, that's how you infect yourself. So the virus on your hands, the skin on your hands is very protective. The virus isn't going to get into your hands. It's going to get from your hands into your body through your mucosal surfaces, which are your eyes, your nose, and your mouth. So if you are washing your hands frequently, you're washing that virus away, and then you're less likely to get it into your body. Also, don't touch your face. So don't touch your eyes, your nose, or your mouth. And that way you'll also prevent it. So hand washing, 20 seconds, rubbing with soap and water. And if you don't have access to water, then hand sanitizer that has greater than 60% alcohol is helpful. And then don't touch your face. I'm at work always like this, not touching myself. So I'm pretty used to that. You have to like create that habit. And this is how you prevent the flu, the cold, all the other respiratory viruses that are out there. The public health department is also telling people if you're sick and you have to cough, you want to cough into your sleeve or into a tissue and throw the tissue away. Because if you cough on your hands and touch something, that's how you spread it.
So we've had a number of reported cases, actually we should say up to 4, in the Bay Area and San Bernardino County, which is south of Gilroy. So explain, I guess, some of your patients, their concerns, or to the Bay Area when we hear this, what should we think?
Well, I've got, last week, I work in San Jose, I told you, I have a lot of international patients who are really concerned. And at this point, what I tell them is put it into perspective that the flu, which causes very similar symptoms, has actually in the United States caused like 15 million people to be infected, and we've had 8,000 deaths. So that's a lot higher number than what we're seeing of this virus. So I would say the number one thing is to get your flu shot every year to protect yourself and then also your family members, because if you get the flu and give it to your family members, you're putting them at risk of getting sick.
All right, well, helpful information, and thank you so much.
Okay, thank you for having me.
Dr. Gross with Stanford Healthcare, I appreciate it. Thank you.
Thank you.
If you'd like more information, you are streaming on CBSN Bay Area. We will be right back.